We all can understand the detrimental impact that radiant heat from bushfires can have on our physical health. But what many of us don't think about is the impact that bushfires can have on other parts of our health. So today I'm here at the Menzies Institute for Medical Research at the University of Tasmania to talk with some of their experts about the other impacts that bushfires can have on our physical and mental health.
My name is James Brady. I'm a Postdoctoral Research Fellow at the Wicking Dementia Research and Education Centre, working on the Island Resilience Initiative project.
Thanks, James, and welcome. Can you explain what bushfire anxiety is?
Bushfire anxiety is anxiety specifically related to bushfires, and so it tends to describe the emotional or psychological distress related to either the thoughts or anticipation of bushfires specifically. Research tells us that it predominantly affects those living in areas that are prone to bushfire or bushfire risk, and or those who have previously experienced such events, but it's not necessarily restricted to just those individuals. Anxiety is similar to stress in that it relates to a heightened emotional reaction to some kind of stimulus. However, unlike stress, which can be a helpful motivator in some instances, driving us to address challenges, anxiety tends to be a bit more of a persevering or a little bit more of a less helpful experience.
What are some of the main factors that contribute to bushfire anxiety?
Some factors that may contribute to bushfire anxiety include past experience of bushfires directly. There are studies that do show us that people who have direct experience of bushfires themselves, having been influenced immediately by bushfires, are more likely to have bushfire anxiety. But it can also relate to others who may have potential predispositions to concern or fixation around potential risks to themselves and or others they care about. So when we think about things that might relate to particular fears, in this case bushfire being the immediate fear, there can be a number of exposures that people may encounter in day-to-day life. This might include conversations and or exposure to advertising materials or media that discusses particular stresses like bushfire. There might also be some sensory factors as well to consider, such as either seeing or smelling smoke that's coming from the bush. And this might also include planned burn-offs, and even though individuals may know that this is a planned burn-off and it's under control, it may still elicit that response.
What are some of the common symptoms of bushfire anxiety?
Some common symptoms of bushfire anxiety or anxiety in general include pervasive thoughts that might impact a person's ability to concentrate, might impact a person's ability to sleep, so sleep disruptions. There might be presence of fatigue, there might be tense muscles. Somebody might also be avoiding situations or areas where they may perceive risk of bushfire. And there are also other factors like irritability and this kind of thing that can be hallmarks of anxiety.
Some would suggest that anxiety about bushfires is natural.
Some degree of stress or anxiety or fear of bushfires as a devastating natural disaster is quite rational, it's quite logical. We should be afraid of these things and we should be experiencing some kind of heightened alertness around them, mainly to reduce our risk of being impacted by them. And so the experience of bushfire anxiety is likely to become harmful or irrational if the experience of heightened emotional or psychological distress continues beyond a point which is helpful or begins to undermine a person's experience of day-to-day life. That is, it's starting to consume them. They may have symptoms of anxiety such as like tense muscles. They may have difficulty sleeping, difficulty concentrating for having these pervasive thoughts going on.
Are there ways that people can manage their bushfire anxiety?
If individuals are experiencing bushfire anxiety, there are two sort of broad approaches they might take to addressing that. So the first one is controlling the controllable. This is not necessarily fixating and being hyper attentive on factors, but a person might be able to lower the degree of concern that they have around bushfires by controlling those factors which are helpful. Things like having an up-to-date bushfire plan, and being familiar with that and being confident that you can enact those behaviours or those steps outlined in the plan. There might also be things like property maintenance. These are things like clearing your gutter, creating fire breaks, or gaining help from people to assist you with managing those if you're unable to do it yourself. So these are generally quite helpful things that a person can do to try and take charge of that concern. The other one is building your bucket. So if there are overwhelming levels of concern or worry, then there are strategies that a person can do to build their tolerance to that level of worry, or perhaps take their mind off it. These are things like mindfulness. There might be meditation, body scanning if there are physical symptoms that they might be troubled by, breathing work, this kind of thing to try and lower those levels of arousal. There are also other factors like, if perhaps there are sensory triggers or stimuli that are upsetting to people, like the smell of bushfire smoke. They may choose to have scents around the house or wear a lotion or fragrance that can be used to mask that scent to try and lower the level of stimulus that's impacting.
Where can people turn to for help about bushfire anxiety?
If a person or somebody they know is experiencing bushfire anxiety to the point that it's being detrimental to their lives, then it's important for them to know that there are help is available, and it can make a real difference to the quality of a person's life. So a good place to start with is a GP. Describing symptoms, concerns to a GP can be a great way to start. GPs are able to perhaps provide some guidance and or make a mental health plan and or connect a person with a healthcare professional like a psychologist or a counsellor with particular skill or expertise in dealing with natural disaster related anxieties. There are also a wealth of freely available counselling and support services that can be found online. These include chatbots through web pages. They also include helplines, and a number of those can be found in the materials associated with this video.